Doctors in the Treasure Valley are now saying COVID-19 is leading to more newborn babies admitted to the NICU. And the doctors say the majority of these babies are being born to unvaccinated mothers. Our Andrew Bartline has spoken with a doctor at Saint Alphonsus today. Andrew, this doctor sounds concerned not only for the babies, but for the moms too.
Yeah, the CDC has recommendations that mothers should be vaccinated, and they just recently made a push this week to get the word out. That's because 22 pregnant women died from COVID in August. That's the biggest month they've seen. And locally, we're seeing why. Guillermo Guzman is an OB/GYN at Saint Alphonsus. He says he has patients who are unvaccinated mothers, and when they get sick, they often can't carry their pregnancy to the full term.
Like all healthcare workers these days, times have been hard on Saint Alphonsus OB/GYN Dr. Guillermo Guzman.
These last 2 weeks have been absolutely devastating.
Right now, 4 of his patients' newborns are in the NICU, the intensive care unit for babies.
It's heartbreaking, it's sad, and as a provider, it just wears down on you.
Guzman says the babies were all born to unvaccinated mothers who got COVID-19. Guzman says pregnant women are more susceptible to respiratory infections like COVID. And that can result in preterm births, in many cases before a woman reaches 30 weeks pregnant. Dr. Guzman says that can spell trouble for the baby.
Them being born prematurely, they have an increase in respiratory problems, digestive problems potentially, and even developmental delays.
We kind of know every single patient that's usually born in this NICU.
Nick Shalygin works in the Saint Alphonsus NICU, and yesterday he said there were 7 babies in the NICU born to mothers with COVID. He says all 7 mothers were unvaccinated.
Those babies prior to being born were showing no signs of distress as we would usually expect when we deliver or admit premature babies.
Dr. Lauren Miller at St. Luke's adds getting vaccinated is equally beneficial for the mother's protection. Because for a lot of mothers getting sick, their only pre-existing condition putting them at a greater risk is their pregnancy.
The moms that I've had in the ICU are completely healthy. They're runners, they're active, they have multiple children at home. They're in their mid-20s or mid-30s. They're not in any other way unhealthy moms.
And the better off a mother is to fight COVID, the more likely she is to carry her pregnancy for the full 9 months.
Comparing outcomes between those unvaccinated and vaccinated pregnant individuals, we can reassuredly say that the unvaccinated population does tend to fare worse if they get infected.
Dr. Guzman says he hasn't had any stillborns from a premature COVID birth, speaking of course only to the patients that he has seen. However, Dr. Miller with St. Luke's says there have been cases here in Idaho where the mother has died, and the CDC reports 97% of hospitalized pregnant women were unvaccinated. Kim?
Tough to hear. All right. Thank you, Andrew.